You know what's scariest about pancreatic cancer? It never knocks loudly. It comes silently, creeping into the body with seemingly harmless signs: jaundice, fatigue, dark urine, unexplained weight loss. Most men ignore it, thinking simply, it's just age. But the truth is, by the time they realize it, it's often too late. This is not far-fetched. Even a healthy person with no medical history can suddenly hear the doctor announce, "You have pancreatic cancer." In this video, I'll show you the 11 most important signs, small symptoms that can save your life if detected early. Stay until the end, because just a few minutes of attention today can add years to your life or that of a loved one. And that's why today, we're going to go through 11 of the most common symptoms, signs that, if you recognize them early, can change the outcome of your treatment. Let me break them down, starting with the most obvious: yellowing of the skin and eyes. Symptom 1. Yellowing of the skin and eyes. Imagine one morning you look in the mirror, but instead of seeing your familiar healthy skin, you discover that your skin has turned yellow, and even the whites of your eyes are clearly yellow. At first, many people think it's just a weak liver, a fatty diet, or simply the light in the room changing the color of their skin. But in fact, this can be one of the earliest signs of pancreatic cancer. When a tumor appears in the head of the pancreas, it can compress the common bile duct, the pathway through which bile flows from the liver to the small intestine to help digest fat. When bile is blocked, bilirubin, a pigment that our skin and eyes turn yellowed, it will overflow into the blood. And then, instead of being excreted through the stool as usual, it accumulates in the skin and mucous membranes, causing our entire body to change color day by day. It is worth noting that the phenomenon of jaundice due to pancreatic cancer does not come immediately like turning on a light switch, but it happens silently and gradually. At first, it is only a slight yellowing of the eyes, then it spreads to the face, hands, and finally the whole body. If you or a loved one suddenly shows this sign without knowing the cause, do not subjectively think that it is just that's how old you are. This is a very strong voice from inside the body, calling for you to get checked soon. Symptom 2. Unusually dark urine. Have you ever walked into the bathroom, looked down the toilet, and suddenly noticed that your urine was an unusually dark color, like the color of a soda or strong coffee? At first, many people often simply think that they are dehydrated, that they drank too little water during the day, or just ate a certain dark-colored food. But if this phenomenon repeats itself for many days in a row, regardless of diet or lifestyle, then this is no longer normal. In the case of pancreatic cancer, when bilirubin is retained and cannot be excreted through the intestines, the body is forced to find another way out, and that is the urinary tract. The kidneys will take on the task of eliminating this substance from the blood, causing the urine to gradually darken, unmistakably. A silent but very clear sign. Unfortunately, many people often ignore it, thinking it is just a temporary disorder. Symptom 3. Pale stool, even discolored. Like urine, our daily stool is also a mirror reflecting the state of health. Normally, stool is brown thanks to bile pigments pouring into the intestines. But when bile is blocked by a tumor in the pancreas, the stool will gradually lose this pigment, becoming lighter, grayer, or even white like clay. Try to remember, have you ever gone to the toilet and noticed that your stool looked strange, no longer the familiar brown color? If the condition only lasts for a day or two and then disappears, it may be due to diet. But if the pale stool persists, accompanied by dark urine and yellow skin, then it is almost certain that your biliary system and pancreas are crying for help. And at that time, it is necessary to see a doctor early, instead of silently enduring it. Symptom 4. Itchy skin of unknown origin. There is a type of itching that makes the patient extremely miserable, itching not from mosquito bites, not from allergies, nor from dry skin. It is itching that comes from inside the body, persistent and uncomfortable, and becomes more intense at night. Many people scratch until their skin is broken, but still do not feel comfortable, because the root of the problem is not on the skin's surface, but lies in the stagnation of bile salts in the blood. When the pancreas has a tumor that blocks the bile duct, the bile salts, instead of going out, accumulate, spread through the bloodstream and stop under the skin, making the skin a chemical reservoir that causes itching. The worrying thing is that this symptom is often overlooked. The patient just thinks that he is allergic to the weather or an insect bite. But in fact, it could be a silent cry that the body has a silent tumor inside. Symptom 5. Pancreatitis that recurs many times. Imagine you have experienced severe abdominal pain. The doctor diagnosed acute pancreatitis, then treated it well. But just a few months later, the pain comes back, and then comes back again, to the point that you have to be hospitalized continuously. You start to wonder, why don't I drink a lot of alcohol, don't overeat, but my pancreas is still constantly inflamed? The answer may lie in the fact that the tumor in the pancreas is blocking the flow of digestive enzymes. When the enzymes cannot escape, they go back, eroding the pancreatic tissue, causing repeated episodes of pancreatitis. This is not normal, and it is not just due to diet. It is a very serious sign, a clear warning that no one should take lightly. Symptom 6. Sudden onset of diabetes or diabetes becomes difficult to control. Imagine you have lived nearly 50 years of healthy life, normal blood sugar, never having to think about measuring blood sugar. Then, within a few months, the doctor tells you that you have diabetes. Or you already have type 2 diabetes, controlled well with medication and diet, but suddenly your blood sugar becomes erratic, difficult to control, and spikes abnormally even though you still maintain your old habits. That's when we have to think a little further. The pancreas is not only the organ that produces digestive enzymes, but is also responsible for secreting insulin and glucagon, the two most important hormones to balance blood sugar. When cancer forms, the tumor will gradually destroy the cells that produce these hormones. As a result, insulin levels decrease, blood sugar increases, and diabetes appears suddenly or becomes worse than ever. Many people think that it is just the age of 50. Everyone over 60 has diabetes, but in fact, rapid changes in blood sugar can be a silent sign of pancreatic cancer. Symptom 7. Floating and fatty stool. Imagine a morning like any other, you go to the toilet. But this time, you notice that your stool does not sink as usual, but floats on the surface of the water. Not only that, it is also greasy, sticks to the toilet bowl, and is difficult to clean no matter how many times you flush. At first, many people think simply, maybe I ate too much fat yesterday. But when this situation repeats for many days, it is no longer normal. The reason is that the pancreas, the organ responsible for secreting the enzyme lipase to break down fat, has been affected. When there is a tumor, the pancreas functions poorly, fat in food is not digested, and goes straight out with the stool. It is this amount of fat that makes the stool lighter, floating in the water. This is a silent, but very valuable sign. If accompanied by rapid weight loss and constant fatigue, you need to pay special attention because your body is warning you. Symptom 8. Loss of appetite and rapid weight loss. One of the most obvious signs of pancreatic cancer is that you no longer enjoy food, even your favorite dishes. Meals become a burden. Many patients share, just thinking about eating makes me tired and nauseous. Why is that? There are many reasons. Undigested food causes malnutrition. After meals, abdominal pain appears, creating a fear of eating. Large tumors can block the digestive tract, causing bloating and vomiting. Or the tumor itself secretes substances that cause the body to become exhausted and lose appetite. As a result, in just a few months, the body can become emaciated and clothes can become noticeably looser, even if you are not on a diet. This is not a matter of getting thinner as you get older, but a sign of a serious illness that requires vigilance. Symptom 9. abdominal pain spreading to the back. Everyone has experienced abdominal pain. But the pain caused by pancreatic cancer has a different characteristic. It often starts in the epigastric region, just below the sternum, and then spreads straight to the back, creating a feeling like a tight rope around the abdomen. What is special is that this pain is more pronounced after meals. At that time, the pancreas is forced to secrete enzymes to digest, but the tumor blocks it, causing the enzymes to eat back into the pancreatic tissue, causing severe pain. Many patients find that they feel better when they curl up in the fetal position. But that is only a temporary solution. If you notice abdominal pain that radiates to the back, is persistent, accompanied by weight loss, jaundice or dark urine, you should see a doctor immediately, as this could be an alarm bell from the pancreas. Symptom 10. Abnormal blood clots in the veins. There are cases where the patient first discovers the problem not from the abdomen, but from the legs. Suddenly, the legs are red, swollen, and painful, and the doctor examines and discovers deep vein thrombosis. Surprisingly, the patient has no risk factors, such as sitting for a long time, surgery, or trauma. In fact, pancreatic cancer can activate the blood clotting system, making the blood more likely to clot abnormally. These blood clots move in the veins, causing swelling and pain, a medical condition called Trousseau syndrome. This is an indirect, but quite typical symptom. If you or a loved one experiences unexplained blood clots, be alert, because sometimes the answer lies in the pancreas, an organ that few people think of. Symptom 11. Chemical peritonitis due to enzyme leakage. In the late stages, pancreatic tumors can cause enzymes to leak into the abdomen instead of the intestine. These enzymes are supposed to break down food, but when they spill into the abdomen, they destroy the peritoneum, the membrane that protects the organs in the abdomen. As a result, the patient experiences severe pain that spreads throughout the abdomen with no identifiable source of pain. This is chemical peritonitis, an extremely dangerous complication. When this condition occurs, it means that the pancreas and surrounding organs have been severely damaged, and the chance of treatment becomes much more difficult. That is why detecting small signs early in the early stages is so important, that it can determine survival. Where does pancreatic cancer metastasize? When cancer cells escape from the pancreas, they often follow the bloodstream to the liver and lungs. That is why many pancreatic cancer patients also have severe jaundice, abdominal distension due to liver damage, or prolonged cough due to lung metastasis. Finally, we have gone through 11 silent but dangerous signs of pancreatic cancer together. From jaundice, dark urine, pale stools, prolonged itchy skin, to more obvious changes such as rapid weight loss, loss of appetite, sudden onset of diabetes, abdominal pain spreading to the back, or unusual blood clots. Each symptom, which may seem small, can actually be a strong alarm bell from inside the body. Many men in their 50s and 60s often console themselves. It's just age, nothing to worry about. But the truth is, it is the habit of ignoring those signs that has made this disease called the silent killer. Because when detected, most of them are already in the late stages. And at that time, the chance of treatment becomes more fragile than ever. The important thing is, early detection will make a huge difference. Just pay more attention to unusual changes. Just check your health in time. We can keep ourselves and our loved ones many more precious years. Please remember, what I share today is only for educational and awareness-raising purposes, not a substitute for medical advice. If you or a loved one has any of these symptoms, be bold and go see a doctor for an examination. If you find this video useful, please subscribe to the channel. Share it with friends and family, so that more people have the opportunity to recognize this dangerous disease early. I will continue to bring you new videos, helping you better understand how to listen to your body and protect your health. See you in the next video, where we will explore together more important knowledge to live a healthy life stronger, and more steadfast every day.